let's do a cardiac patient. Ooh, because I love cardiac. So this is interesting. Chest pain after a personal loss, number 217. Why not? Patient's a walk-in. 59-year-old with chest pain, rated 9 out of 10, described as crushing. The patient is crying inconsolably. Oh, my heart just hurts so much. Direct to resuscitation base. So what I'm already getting in my head is something called Takotsubo. The common name is broken heart syndrome. Let's assess our little lady here. So let's get some vital signs first before we do anything. All right, so she is tachycardic, blood pressure normal, afebrile, pulse oxing fine, respirations are good. And because she does have chest pain, we're gonna insert an IV just in case she needs any emergency measures. So Beatrice Nunez, 59 years old, full code. Okay, let's chat with her. Who is Annie? Oh, I don't blame you. I'm so sorry. Oh, okay. So, what are your symptoms? I have chest pain, shortness of breath, and feeling lightheaded. Okay. How long have you had chest pain? Oh, yeah, that's very common for Takotsubo. It's very interesting. If she has Takotsubo, it can cause MI symptoms, and it could even cause, a cardiomyopathy. It's all temporary, but it's very emotional based, so very interesting. Chest pain, middle of my chest with some going to my right shoulder. Okay, so that is abnormal, but because she is female, this could possibly still be an MI because females are increased risk of atypical MI symptoms. But I've been feeling lightheaded along with the chest pain. Chest pain hasn't gone away with anything I've tried so far. Okay, so no known allergies. Okay, type 2 DM, high blood pressure, high cholesterol, and depression. So metformin, that treats a type 2 DM, amlodipine, rosuvastatin. So amlodipine is for the high blood pressure, rosuvastatin, that's for high cholesterol, escitalopram, that is for the depression, and Ativan, that is used for, any anxiety. I took my Ativan yesterday before Annie passed away. Oh, that's so heartbreaking. So let us do an exam. Let's assess, see what's going on. Uncomfortable and acute distress, GCS, that's Glasgow Coma Scale, that is normal. All right. So we always start with the ABCs because that is our priority. So ABC, normal, heat, good, neck, good, cardiac, tachycardic, yes. Okay, pulmonary, normal, abdomen, good. Psych, I know it might seem silly. Oh my God, what a cute little doggy. I know it might seem silly to be upset and sick over it, but Annie was my whole world. My husband passed away years ago and I don't have any family. So she's been my only companion. Oh, I adopted her from an animal rescue 5 years back, and it's just been me and her ever since. I just feel an awful, terrible weight inside me and this intense pressure across my chest. I can't believe she's really gone. Would you like to see a picture of her? Oh, that's so cute. Oh, that's very sad. That's very, very sad. Oh, all right. Well, I definitely think this is Takotsubo, but let us get some lab work and definitely an EKG because she is a diabetic. We're going to get a finger stick. Labs, anytime there's any sort of urgent, case coming in, you always want to get a Chem 7, CBC. We're going to get a coagulation panel just in case. We don't need a calcium. I'm going to get a D-dimer just to rule out any PE. Lactate. Doesn't look like she's in any sort of shock. Let's definitely get some LFTs, some mag, phos. Troponin, absolutely. Want to rule out MI. Pro-BNP, we're going to get a UA. We're going to get a CK. We're going to get a sed rate, CRP. No, she does not need a serum HCG. She is 59 years old. A little too old for that. I'm definitely going to get an x-ray of the chest, just because she has been complaining of chest pain radiating to the right shoulder. Man, I wish I was in a hospital that all the results came back this quick. So let's look at the x-ray. All right, normal lung fields, no evidence for edema or infiltrate. All right, that's good. So CRP normal, CK, so yeah, this is kind of consistent with Takotsubo. Ooh, whoa, she might be having an MI. Okay, so CK is usually, this is usually a lab that's drawn in relation to some sort of muscle impairment. So she might be having muscle impairment, but that troponin, that's not good. So she might actually be having an MI. Oh, I mean, she does have a history of DM. She is a female. Also hypertension. So look at the EKG. Ooh. All right, so let's look at V2. So because I'm a cardiac nurse, I have to look at this. So she has a left axis deviation. Let's see, T wave inversion, AVL, AVF, 4 through 6, lead 1. So lead 1, V4 through 6, T wave inversions. I wish I had an old EKG. So I would definitely call this abnormal just with the left axis deviation, the T wave inversion. So interestingly, it's pointing at something going in the left circumflex. The way I can tell is 1 is anterior, and the left circumflex is basically anterior, left lateral, inferior. So it's basically showing, EKG changes in lateral and anterior leads. That's making me say, So we're going to communicate with cardiology. All right, let's do a bedside echo and then decide whether or not take her to the cath lab. Okay, so let us do an echocardiogram. So that is ultrasound cardiac. All right. Yeah, so this is very consistent with Takotsubo. Interestingly, the ejection fraction is decreased. So normal ejection fraction is 50 to 55% and above. So it's basically showing left ventricular systolic function. It's definitely decreased at 30%. Apical hypokinesis, so the apex, which is the bottom of the heart, is not moving as well. But it's good, no wall motion abnormalities. So the coronary arteries are looking good. Mild mitral regurg, that is normal. So yeah, I really think she has Takotsubo. Oh, this poor lady. So Takotsubo, the common term is heartbreak syndrome. All right, so let's communicate with a grief counselor. She definitely needs one. I'm available to talk with her and can be involved in care planning. Let me know when you have a better idea of her medical stabilization needs. Let us talk to her psychiatry. I'll make sure to coordinate with her admitting physician, but I would like to be involved in this care. They're grieving and will need support and resources. I agree. Aw. So for the chest pain, nitroglycerin, in case you guys are unsure, here you go. Some information about the medication. I'm gonna give her a little nitro, give her some break from the chest pain. Let's lay her flat. So one of the quickest ways to raise blood pressure, lower head of bed. I crashed your pressure, and I apologize about that. Let's do an infusion of saline. Let's give her some Ativan. I believe that'll help her out. Great, I just crashed your pressure even more. All right, so that was not good. We're gonna give her a bolus because I just crashed her pressure. How are you feeling? Feeling a bit better with the medication for anxiety, but I'm still very sad about losing Annie. Oh, I know. All right, so there's not much else I can do. So yes, she has Takotsubo, cardiomyopathy, broken heart syndrome. Usually the triggers are extreme emotional distress, which, yeah, she definitely does because she lost her dog. Transfer to cath lab. Yeah, we are going to transfer to cath lab because, so when I used to work cath lab, we did get a patient who had Takotsubo. It's always good to take a look at the heart, just in case. Takotsubo, cardiomyopathy. We'll see if I'm right. Oh my gosh. Woo! Oh yeah, 96.8. 96.8, yeah, go Grace the nurse, cardiology nurse. So I was correct, Takotsubo cardiomyopathy. So very good, very good. What do you mean interventions 20.6? All right, I gotta take a look. I got a high score. Lorazepam bolus, yes. Oh, yeah, I forgot about the aspirin, my bad. But I am so happy for the 96.8, heck yeah. All right, that was awesome. So thank you guys so much for joining. I really appreciate all of you. Check back tomorrow. I think I'm gonna be doing some NCLEX questions, so we'll go from there. So thank you all very much, and I will see you tomorrow.